As little thought as it is given to what happens with what we leave behind, even less thought is given to who might collect it after us or to the potential value of what is collected. Tons of waste produced daily endanger our environment. Waste recycling has become a source of employment, with more than 1.5 million people globally and an annual profit over $160 billion. The city of Belgrade in Serbia, with the population of 1.5 million people, produces 780,000 tons of waste annually. That's 10 kilos of waste weekly for every person. Sadly, just 10 to 15% of that waste is recycled. That's 5 times less than in EU countries. In some countries, members of vulnerable and marginalized populations are often seen scavenging waste. This is their livelihood, which allows them to survive somehow. Scavenging communal waste bins represents a large-scale operation in Belgrade, with some bins being visited up to 40 times per day. Such primitive recycling work is being performed by members of vulnerable populations, predominantly the Roma people who are marginalized from mainstream society. Roma families, adults and children can be seen collecting recyclable materials without protective clothing, regardless of the weather conditions, both day and night. The income made for such labor is pitiful and makes for an existence well below the poverty line, as these communities are often the subject of exploitation by various waste recycling middlemen.
Children born into vulnerable populations, such as the Roma population, have limited choices in life. They have difficulty in accessing education, health services and social protection. This population is trapped in a vicious cycle, with generations of families living in poverty throughout Europe with little or no chance for improvement. Amongst the many problems these communities face, the most well documented are extensive social exclusion, poverty and ill health. A lack of basic personal identification documents such as ID cards, working booklets and healthcare cards are the main reasons why Roma cannot exercise basic civil rights or obtain effective access to public services. Naturally, in such circumstances, obtaining regular employment, receiving proper healthcare, and educating the younger generations becomes hard, if not impossible. Therefore, the cycle of poverty just continues.
The Roma people represent a group mainly from India, which migrated through Persia between the 3rd and the 7th century. The first records of Roma in the Byzantine are from the 11th century, and in the southeast Europe from the 14th century. By the 20th century, Roma people populated all continents. Today, there are between 10 and 15 million Roma people living in Europe, and 15 to 30 million living worldwide. The last census in Serbia estimated the Roma population to be 108,000. The generally accepted estimated number is considered to be close to 500,000. Statistics relating to the Roma population present a very poor picture. 19.7% of the Roma people in Serbia are considered illiterate. The mortality rate of Roma children is 25 per 1,000 live births, while for the rest of the population is 7 per 1,000. The probability of dying before the age of 5 is 28 out of every 1,000, which is 3 times more than the national average. While 6% of children in Serbia lag behind in growth, in the Roma community this percentage is up to 20. Roma children attend kindergartens 8 times less than the national average. Only 1/3 of the Roma population has houses connected to the sewage system. Half of the Roma use the traditional toilets, while 5% of the Roma population live without it. The majority of Roma lives within settlements. There has been identified 593 settlements in Serbia. Every 10th Roma household is extremely poor, meaning that they cannot satisfy even the basic food needs. Roma are 6 times poorer than the average Serb.
štete, ljudi, nema ideje sad. Eto.
Kako izgore?
Kako? Palilo se. Mora ljudi, imaju malu decu, mora greju. Ja ne grejem, ne ložim. Dok sam ja stariji čovjek, šta će meni grejati?
The government of Serbia and the city of Belgrade are making efforts to improve the living and social conditions of the Roma communities, and relocation of illegal settlements is implemented through a major infrastructural project. Such settlements are being provided with better accommodation and infrastructure. To assist the Roma people in accessing healthcare, the Serbian government has implemented the Roma Mediator Program, which is conducted in many countries in the Balkans. This program is proving effective in increasing of the number of the Roma people using and trusting the healthcare services. The WHO European region, with the support of the Norwegian government and other UN agencies, IOM and UNOPS, have joined together to support the Roma community and Serbia through the SWIFT initiative. The SWIFT initiative is aimed at ensuring accessibility to state and city services, including healthcare, through healthy and productive employment. It aims to transform the informal waste collecting into a legal means of employment, increasing their professionalism and their dignity together with the promotion of health, education and social protection. By provision of legal employment, those who are currently invisible to the state and its services will be provided with legal documents entitling them to health and education. The SWIFT initiative focuses on three objectives: health and environment, ensuring access to health care for the Roma people and their families as members of the cooperative; income generation and employment, addressed by the development of recycling centers; social mobilization, ensuring registration, access to personal documentation, and generally bringing the Roma community in closer contact with government structures and institutions. The Swift Recycling Center is built and opened in February 2011. The center is now fully equipped and operational as a cooperative, providing its members with adequate income. It is registered as a business to perform activities of development of agreements with waste producers, collection, sorting, processing and selling of waste materials through agreements with buyers, engagement in additional services as office moving and cleaning. Cooperative members already demonstrated job dedication, teamwork and corporate responsibility. Their achievements include the concrete ability to establish and maintain professional relations with businesses and embassies, through which 80% of center's capacity was reached, and to gradually build its self-sustainability. SWIFT started small, but it is expected to reach over 100 new cooperative members by the end of the year.
Od kako je otvoren SWIFT centar, romska populacija je zaista mnogo dobila. Svi neformalni sakupljači otpada sada mogu biti formalni sakupljači otpada. To znači da svi oni mogu doneti svoj otpad u SWIFT centar i donose, gde dobijaju novčana sredstva za izdržavanje sebe i svojih porodica. Oni će ujedno biti prijavljeni za staž i za socijalno i zdravstveno osiguranje. Samim tim što imaju socijalno i zdravstveno osiguranje, imaju veći pristup državnim institucijama.
The SWIFT community is integrated into closest primary health center, and each of these centers is equipped with the ability to tailor its services to the SWIFT community health needs in a sensitive way. The cooperation and partnership with the Ministry of Health and local health services provides a support mechanism to SWIFT members. So far, the cooperative members are more aware of their civil rights and responsibilities, and acquired new tools to more easily access formal health and social benefits. The good practice of formal waste collection, mutual learning, and cultural activities offered in the center become tools triggering community revitalization in Orlovsko settlement. The SWIFT initiative generated significant interest amongst government stakeholders such as ministries, municipalities, and the donor community. 2 additional centers are planned for opening in Belgrade. The WHO, IOM, UNOPS, and the UN family in Serbia hope that the SWIFT initiative would serve as one of the comprehensive models where vulnerable populations are provided with the opportunity to be included into the general society, to exercise their rights to health and education, and break their cycle of poverty. We hope that the issues of the Roma people, as well as other vulnerable populations, will be addressed through this effective approach.
SWIFT is a dream. It's a dream where you take a group of people that work so hard for many, many years, for hundreds of years, but are not visible to society. So with this tool, we actually show them and show the society, the population all around them, that they are equal and they work for equity. And this is the message of SWIFT.